Hello guys, welcome to my channel. So today we're going to discuss about elbow assessment. So first we go for the history. So first we ask the patient how old the patient and what is the patient occupation, because the age is vary, because in some particular age there is chances of a particular condition, or some patient with some occupation, like if a tennis player comes to you and complaining of elbow pain, then there is a chances of tennis elbow, and if a student comes, then there is chances of student's elbow. So there's some occupation which correlate with some diseases. So first we know about the age and the occupation, then what is the mechanism of injury, like fallen outstretched hand or direct trauma or repetitive injury, you have to ask. Then how long the pain was persist and which activity aggravate the pain. So you can ask the patient how long the pain is persist, or for hour or for a day, or morning, when the pain started and how long it persists, and which activity aggravate the pain, then you can find the original cause of the pain. Then what is the nature, like it continuous or intermittent, or type like dull aching, deep boring, tingling, throbbing. You can ask the patient, and extent of pain, so you can know if it radiating or not. Then are there any position which relieve the pain, relieving factor, you have to ask. Or which moment does the patient feel restricted, does patient having any history of previous injury, and which patient unable to do functionally, and which hand is dominant, you have to ask. Then in observation, like in shoulder observation, I told that how patient enters the department is the main fact. You can see the patient arm swing and which position patient held the arm. And in the body build, you have to see patient is ectomorphic, endomorphic, or mesomorphic. Then you can see the swelling, atrophy, you can see the atrophy, swelling, atrophy, or skin color changes. You can see non-palpate only, you can observe. Then posture, you have to, in interview, you can see the carrying angle of a patient. So carrying angle in male is 5 to 10 degree, and female is 10 to 15 degrees normal. If it more than 15 degree, then there is a it called cubitus valgus, and less than 10 degree, you can call it cubitus varus. Then there is a posterior view, you can see the olecranon bursitis, um, swelling of the olecranon process, there is answer of olecranon bursitis. And a triangle sign, which I missed, sorry. The triangle sign, at 90-degree elbow flexion, the olecranon process of ulna and the medial lateral condyle form a ossical triangle, in some called triangle sign. So whole elbow is consist of this triangle sign. So then we go for the palpation. So in palpation, we first we measure the swelling by inch step, and compare to the normal side how much swelling is present. And atrophy also, you can measure the limb girth. Then in surface anatomy, you have to palpate the bone, the muscles, you have to palpate. Then for the referred pain of the muscle, like in biceps, you have to pain on the bicipital group. In brachialis, pain on the anterior arm, elbow, and lateral thenar eminence. In triceps, there is posterior forearm to medial two finger. In brachioradialis supinator, there is pain on the posterior web space between thumb and index. And in anconeus, there is pain on the lateral condyle. In pronator teres, there is pain on anterior forearm. In extensor carpi ulnaris, there is pain on medial wrist. Extensor carpi radialis brevis, there is pain on posterior wrist. Extensor carpi radialis longus, there is pain on the posterior lateral forearm and wrist. Extensor indicis, then pain in posterior forearm. Palmaris longus, there is pain in anterior forearm. And flexor carpi ulnaris and flexor carpi radialis is pain on anterior medial wrist. And flexor digitorum superficialis, palm to digit. So thank you. In next video, we discuss about the range of motion, manual muscle testing, and joint play of the elbow joint.